Hello everyone, I'm Dr. Hiteshwar Singh Kalsi and I'm here with new series Revise in 5 minutes. Here we'll discuss various dermatology topics and today's topic is Acanthosis nigricans. Firstly, what is Acanthosis nigricans? It is a skin disorder characterized by hyperpigmentation and hyperkeratosis and it occurs mainly in axilla, groin and neck. It is a sign of an underlying disease. What is the etiology of acanthosis? It can be hereditary or it can be due to endocrine disorders such as insulin resistance, that is diabetes, hyperandrogenic state, and hypothyroidism. It can also be caused by obesity. Some drugs such as nicotinic acid, niacinamide, oral contraceptives, and steroids also cause acanthosis. In malignant form, adenocarcinoma of the stomach is most common cause. Now coming forward to clinical features. Hyperpigmentation and thickening of skin with papillomatous elevation is seen. Velvety symmetrical plaques are seen predominantly on the neck, axilla and groin. The posterior part of the neck is most commonly affected site in children. Pruritus may be present. Acrocodons are often found. Mucous membrane and nails are sometimes involved. Now we can clearly see velvety appearance of posterior part of neck. This is a picture of axillary acanthosis, elbow acanthosis. Now coming forward to this picture, it is very important. We can see acrocodons here, that is skin tags, along with Acanthosis nigricans of groin region. What is the classification of acanthosis? It can be classified into following types. Firstly, hereditary. It presents at birth and childhood. Benign. It is associated with endocrine disorders. Obesity. It is reversible on weight loss. Autoimmune. In this, antibodies against insulin receptors is formed, such as in SLE. Drug-induced. We have already discussed that. Malignant form. Adenocarcinoma of stomach is most common cause and it presents as sudden, extensive and progressive form. Acral. It occurs in patients with dark complexion and it occurs mostly over elbows, knees and knuckles. Nevoid. It is a rare form and it presents unilaterally. Generalized. It is rarely present in pediatric population. In mixed form, a person already has one type of AN and then develops new lesion due to some other cause. Benign AN is most commonly found in adults, but it can also occur in other age groups. And malignant AN, it is frequently seen in elderly persons. Some associated disorders are dermatomyositis, diabetes, gigantism, Heron syndrome, that is hyperandrogenism, insulin resistance, and acanthosis nigricans. Hashimoto thyroiditis, LD, phenylketonuria, PCOS, Prader-Willi syndrome, and Wilson syndrome. Now coming to the pathogenesis, no clear mechanism is known, but some syndromes associated with that divided into insulin resistance syndrome and fibroblast growth factor defects. In benign forms, keratinocyte and dermal fibroblast proliferation is seen that is stimulated by insulin or insulin-like growth factors. In malignant form, it is stimulated by substances secreted by the tumor. Some exogenous medicines such as injection of insulin also cause acanthosis. Histopathology. What do we see in histopath? Firstly, hyperkeratosis and papillomatosis is seen. Here we can see hyperkeratosis. The dermal papillae project upwards as finger-like projections. These are the finger-like projections. Mild acanthosis between the papillae is seen here. Envity ridges are poorly developed. What are the differential diagnoses of acanthosis? Lichen simplex chronicus, hyperpigmented nevus, Addison disease, hemochromatosis, and pellagra. What all investigations do we do in acanthosis? We screen for diabetes by seeing HbA1c and glucose tolerance test, and insulin resistance can be seen by plasma insulin. We also consider searching for underlying malignancy in adult onset acanthosis. This is a picture of Acanthosis nigricans under dermatoscope. Treatment part. The goal is to correct the underlying disease. We can give medical care and surgical care. Under medical care, correction of hyperinsulinemia is done, weight reduction is done, topical keratolytics is given, such as tretinoin 0.05% cream, ammonium lactate 12% cream, along with daily sunscreen. Orally, we can give isotretinoin, cyproheptadine, which inhibits the release of tumor products, and PUVA therapy can also be given. Lastly, cessation of inciting drug is of utmost importance. Under surgical care, we can do dermabrasion and surgical removal of tumors is done. That's all for today's topic. Thank you for watching, and if you have any question, do comment down. I'll try to answer it as soon as possible. Thank you.